3, 2, 1, go.
Hey guys, it's Dr. B here again. We're going to continue our discussion about the shoulder. And today we're going to talk a little bit more about anatomy, but not necessarily the bony anatomy, but more of the soft tissue anatomy and the muscles, in particular the rotator cuff muscles. Now, an easy acronym to remember the rotator cuff muscles is going to be SITS, S-I-T-S. Now the S right here stands for supraspinatus, I for infraspinatus, T for teres minor, not teres major, and S for subscapularis. So if you look at the board, I'm going to draw these on there for you to give you a little visual representation. So let's look up here. Here's the spine of the scapula. So this visual right here is looking from the posterior aspect or back to front. So if I face this direction, you're looking at my shoulder blades just like that. Now, on top of the spine or superior above the spine, you have the supraspinatus, which is going to come through like that and hook onto the top of the glenohumeral head. Below the spine of the scapula, or inferior, the infraspinatus is going to come through like this and attach onto the head of the humerus as well. Now, in this region right here, in very close proximity to the infraspinatus, you're going to have your teres minor, and it's going to come just like that. It's a really small muscle, nowhere near the size of the supra or the infraspinatus. And I can't really show you on this representation, but the other muscle is the subscapularis muscle. Now, if I face you just like this, and you could see through my rib cage, through my lungs, etc., you would see the front portion of my shoulder blade or my scapula. That's where the subscapularis is, and it hooks around to the inside and attaches onto my humerus right here on the front side, whereas these other muscles attach to either the top or the posterior or back portion of the head of my humerus. Now, these muscles are responsible for the dynamic stability of the glenohumeral joint. You also have what we call ligaments that provide a static stability, and static stability does not necessarily require any motion. So ligaments themselves are smaller structures, they're very tough and fibrous, and they're basically there to support that joint and basically check movement. So there's glenohumeral ligaments, which attach the glenohumeral head to the labrum, and they're just going to be in through that area. Now basically what they're doing is similar to what the ACL or the PCL does in your knee. And if you're not familiar with those ligaments, don't worry about it. We'll talk about it in a later video. But essentially they check motion, so they don't allow it to go too far forward or too far back or too far up or down. They really just kind of hold it in that general position. Now, like I said, the rotator cuff muscles, the SITS muscles, they're there for dynamic support and stability. And there's one more muscle I want to talk about, and that's your deltoid muscle. The deltoid muscle is going to be over here. It's going to be just like that. And this is important because when I do this motion, which is abduction, I'm bringing that elbow up in the air. My middle deltoid right here is performing the majority of that motion. And when that happens, my humerus wants to go up or superior, which brings it closer to the acromion process. Now these rotator cuff muscles basically act directly against that. So they're basically holding that humerus in place, pulling it down, keeping the humerus from jamming into my acromion and causing an impingement syndrome. So I talked about in a previous video of mine some of the anatomical variations of the acromion. Those are more of a mechanical type impingement, whereas this is more of an impingement that could be caused through like a muscle imbalance, or maybe your muscles aren't firing properly. So I hope this video helped. I hope it cleared up some of the questions. Now you know kind of some of the mechanical or anatomical physical barriers that could cause an impingement, such as the variations of the acromion, and now you know how the rotator cuff muscles play a role in stabilizing the shoulder and preventing you from having an impingement syndrome. Feel free to contact me on social media, Instagram or Twitter @thesportspod, or #AskDr.B. Have a good one.